Welcome to my health channel. When my health really matters to me and is my priority. This video is part 2 of the osteoarthritis topic. Please kindly make sure that you will watch part 1 of this video. In this particular video, I'm going to talk about how osteoarthritis impacts on one's life, and I'm going to talk about how to manage osteoarthritis and the treatments. Osteoarthritis affects people very differently and affects different joints. Some people have it mild to moderate and some have it very severe. And for others, it may get worse over time. Everyone's situation will be different due to degree of damage to the joint. Some would have lots of pain with severe mobility problems. For some, it may just be a little or a few symptoms. The spine, the knees, the hips, and the ankle are the weight-bearing joints. This is why some people find it hard to walk around, climb the stairs, and get out of the chair. Pain in these joints can reduce the range of joint movement. After periods of rest or after a full night's sleep, there is likely to be increased stiffness. We know it can affect performing everyday activities and tasks like dusting and vacuuming, to mention but few. There's an increased risk of fall. There's also a risk of falling with the elderly, but this depends on the symptomatic lower limb joints. I have seen younger ones also at risk of fall. There is loss of independence, especially for those who have it in their hands. Performing tasks become a big issue because they may have issues with having firm grips or having finger movements. Usually they have problems with cooking, cleaning, or picking up groceries. This might exacerbate joint pain and swelling. Okay, for those who have the shoulder or the elbow arthritis, it becomes hard to lift or carry weight. This can become very upsetting, especially if you've always had an independent life. For some, osteoarthritis becomes or means a loss of livelihood or earning capacity. Sleep is reduced when one has osteoarthritis. Sleep quality declines with age, as we know, but for someone with osteoarthritis, they may lose sleep even more. Those who have osteoarthritis become less physically active because it hurts to move. This means they don't get physical activity. This type of sedentary lifestyle makes the condition severe. Muscle atrophy can develop, and we know that reduced activity can increase weight gain, which may lead to other complications. Social isolation is another great impact because osteoarthritis restricts the ability and desire to go out and socialize. This condition makes the person to be socially withdrawn and have limited interaction with people because of the painful symptoms that comes with it. This may increase the risk of mental health problems. How do we manage osteoarthritis? Well, one has to accept that it will impact or impair quality of life. It's a condition that will worsen if not managed. We have cases of people who have continued to live a normal, healthy, and active life despite this condition. Balanced nutrition and adequate physical activity are important to maintain both physical and mental health. There is a need to strengthen the muscle and trying to avoid weight gain. Healthy nutrition and exercise can help to reduce inflammation or swelling and may improve pain tolerance. Exercise can reduce the risk of anxiety and depression too. This condition can be managed either through treatments or a combination of treatments. People use alternative therapies like yoga, acupuncture, tai chi to preserve physical and mental health. Pacing yourself is very important. Break things you want to do into smaller parts or chunks. Don't rush. There is no need for a rush. Allow time to do things to cause you less pain. Supplements. Now, supplements includes remedies, vitamins, minerals, dietary supplements. This will be your choice to take them, and if it helps you, take them. Check with your doctor and pharmacists. If you are taking over-the-counter medications, it's important to look out for side effects. It's important to know about drug interaction. Okay, and if you notice something developing, you need to speak to your pharmacist or your doctor as soon as possible. Complementary treatments like acupuncture, although I've mentioned it before, Alexander technique, aromatherapy, massage, osteopathy, and chiropractic techniques may help ease some of the symptoms, such as pain and stiffness and general well-being. Finally, surgery as a last resort. But you have to discuss this with your doctor, and if your doctor feels the need to refer you to an orthopedic consultant, then he will do that. And it's very important, but this is as a last resort. Okay, now if you look on the screen, you're going to find people with symptoms of osteoarthritis, pain in the leg, swelling in the leg, okay, pain in the back. Those are symptoms. Okay, stiffness, swelling in the joints, okay, swollen fingers. You can't miss that one out. Pain, inflammation, swollen fingers, pain that comes with it. Okay, now if you look in the next picture, you're going to see the highlighted areas on the body. Those are where the joints are in the body. Okay, now for those who have these already, continue to stay strong. Everyone with this condition, please stay strong. It's not very easy to live with this condition, okay, because you're living on painkillers and you're trying to manage your pain, and you're missing out a lot. You can't interact with friends, you can't go to work, you can't move around as you normally would. When this happens, this part of life, stay strong, okay, but take painkillers to help manage your pain. It's very important, okay. Do activities to distract you. Perform activities within your limits, of course, okay. Try and push yourself to do things. It's very important. Don't give up, and never ever give up, okay. Keep your life going. It might be difficult for you to do things, but just work within your limits, okay. Don't give up, okay, because you still have life ahead of you. Manage with painkillers, okay. Where you can do without painkillers, do without it, okay, because long-term use of paracetamol, for instance, causes liver damage, and you don't want that, okay. And long-term use of non-steroidals also can cause you problems in your stomach as well, okay. Or if you have gastritis or you have ulcers already, you might be triggering it off when you take them. So you just have to find a balance, find what works for you, and use it, okay. Keep your life going. I will upload a video on gout very soon. Try to watch it whenever it's uploaded. Thank you so much for watching my video. Please share this video to your friends, like and subscribe. Thank you for watching. I'm so grateful. Have a good day and see you back soon. Bye bye.